Hello everyone. I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Today we will be studying about the parenchymal infection. Okay. And parenchymal infection is the last segment of your central nervous system. In this, we will be discussing about the various infections like the bacterial, then you have the viral, then you have the fungal, and the parasitic. So these are basically the four broad categories that you have: bacterial, fungal, viral and parasitic. So let's first see what is parenchymal infection. So parenchymal infections is basically an infections of central nervous system which involves the parenchymal tissues, right? You have the parenchymal tissues that are there in your central nervous system. They are of two types. First one is the meningitis and second one is the ventriculitis. Ventriculitis represents the ventricles that are there in your brain. And meningitis means the meninges plus your CSF. In the ventriculitis, you have the ventricular system, the third ventricle and the fourth ventricle, right? Let's talk about the classification. Mainly. So, first one you have is the pyogenic. Pyogenic ones are called as the bacterial one. In that, you have the brain abscess. So, remember it's B for B. Bacterial is for the brain abscess. First, then you have the granulomatosis. In that you have two categories. You have either the tuberculoma or the fungal. Then next you have is the parasitic. In the parasitic one, you have the first one is the Neurocysticercosis, second one is the toxoplasmosis, then you have the amoebic encephalopathies like your Naegleria, acanthamoeba and the Balamutia. Okay, so acanthamoeba is nothing when you wear contact lens. When a person wear contact lens without the proper sterilization and like he washed that contact lens with the help of a tap water, okay, and he wore that contact lens again, then he developed this kind of infection. Next is the hydatid cyst and fifth one is the trypanosomiasis. Okay, that is due to the trypanosomas. In the viral one, what you have? In the viral one, you have the first one, HSV1 encephalopathies. Then you have the Japanese encephalitis. That is the most common. In Japanese encephalitis, what happened? The leg of that person swells up, right? It becomes like a leg of an elephant. Like this is the leg and it becomes like a leg of an elephant. Okay. Then you have the rabies, and you know guys what? Rabies is 100% fatal. Like if a person develop rabies, there are chances and there is surety, not chances, there is surety that the person will die. Okay. Fourth one you have is the HIV encephalitis. Then you have the fifth one, that is your subacute sclerosing panencephalitis, that is your measles. Okay. Let's understand them. Firstly, let's understand about the pathogenesis in journal. What happens is, there is a pathogen, like I'll draw it for you. This is your brain, okay? It's looking like a Pikachu, but let's assume that this is your brain. What happens is, you have a pathogen. Okay, let's draw just one pathogen, okay? Then we will make him our hero. You have pathogen. Now what happens is, they enters your CNS and after that they spread to another organ like your lungs, like your heart, and like your GIT tract. Okay, they basically spread to other organs. Then what happens? Then there is penetrating trauma or the neurosurgery that you need to carry out. Okay. What is local inflammation? Local inflammation is necrosis plus edema. What is the host response? When the pathogen will enter your body, what will be the response? Either it can be acute or either it can be chronic. In the acute one, there will be neutrophilic infiltration, that is the formation of abscess. Obviously, the WBCs will come into the actions, the WBCs will get active and there will be the abscess formation. Then you have is the chronic. In the chronic one, you will be having chronic granulomatosis, that is seen in your tuberculosis and fungi. And you know guys what? Granulomas are of two types. Either they are caseating or either they are non-caseating. Okay, that we will study further. In the immunocompromised patient, what happens is the granulomas are poorly formed and they form the lesion. There will be space occupying effect, like there will be increased intracranial pressure. And when there is, like this is your brain, when there is increased in the intracranial pressure, like this is the intracranial pressure and it's rising. So what happens is there are chances of herniation. There are chances of herniation. Okay. Next, what are the major infections you have? Let's just study them one by one. The first one that you have is the brain abscess. The first one that you have is the brain abscess. Now what happens in the brain abscess? See, abscess is resembling to a term called as your pus. Okay. So remember, P for pus, P for pyogenic bacteria. What happens is the common organism which is there is your Streptococcus viridans. It is the most common organism involved. Then this organism enters, this bacteria mainly enters the brain and causes this abscess and causes this yellow dirty fellow like abscess. Okay, what happens? What are the predisposing conditions? What are the conditions that leads to this kind of infection? First one is your chronic otitis media. This you will learn in your third year ENT lecture. No, third year is, I guess it is in fourth year, right? Because third year has been shifted to fourth year. Then you have mastoiditis and sinusitis. Sinusitis is the inflammation of your sinuses. Okay. Mastoid is the inflammation of your mastoid. And CSOM, chronic suppurative otitis media, you will learn in your ENT. Next, what is the pathology that is there? You have the three stages. What are the three stages we have? First one is the early cerebritis. Okay, what happens in this? First one, there will be neutrophil activation. Second, what stage is there? The second stage that is there is your late cerebritis. What happens in this stage? There is necrosis. Then there will be early capsule. What happens in this stage? There will be collagen deposition. Then there will be late capsule. In this stage, there will be, it will be surrounded by a gliosis. Okay, it will be surrounding by a gliosis. First stage, you have N and N. Okay, two N's are there in the first stage. That is neutrophils and necrosis. In the third stage, you have the capsule, C for C. Capsule is for collagen will be there, and then in the late one, you have the gliosis. What are the clinical features that you will be able to see? There will be a triad of fever. Obviously, there is pus, so there will be a triad of fever will occur. Then there will be headache. Then there will be focal neurological deficient. The person will be not oriented to time, place, and person. Okay. And the GCS of that patient, the Glasgow Coma scale of that patient will be hampered. Seizures are the most common symptoms that will occur. Then you will have the papilledema and the signs of increased intracranial pressure. If the abscess rupture, like this was your brain, here was your abscess. If anyhow this abscess rupture, this will go to your ventricles. This will go to your ventricles and will cause ventriculitis. What are the investigations you will order? First thing that you will order is your ring enhanced lesion with contrast hypodensity. You will order the CT or MRI, and in that you will be able to see a ring enhanced lesion, right? Like, let's suppose this is your brain. Okay, I know it's not brain, but for a while let's suppose that this is our brain. So when you will do the MRI, you will be able to see a globular lesion over here. This is nothing but your ring enhancing lesion. Why they are calling it as enhancing? Because there will be a lot of lighting that will be there. Okay. Then you will do the lumbar puncture. Then you will order the blood culture. For the treatment, what you will do? You will give them, this was a bacterial infection. So you will give them the IV antibiotics. Then you will do the aspiration if it is needed. What you will do? You will just aspirate some amount of fluid. That is, if the abscess is more than or equal to 2.5 centimeter. Next that you have is about the tuberculoma. Okay. In the tuberculoma, what you need to know? The name is suggesting tuberculoma. So it is something related to your tuberculosis. What causes tuberculosis is your Mycobacterium tuberculi. Right. And they are mainly from the pulmonary foci. Right. What is the pathology that is involved? You have the central necrosis. Second thing that you have the Langerhans giant cells. Okay. What are the clinical features that you will be able to appreciate? The clinical features that we will see, first one, there will be seizures. That is most common in children's. There will be raised intracranial pressure. See guys, we have made a list of certain important clinical features that are there. First one, there will be seizures. Second one, there will be increased intracranial pressure. And third one, there will be the focal deficit. This means the person will be not oriented to time, place, and person, and the GCS score of that person is hampered. Okay. In the imaging, what you are able to see? First, you will order the CT and the MRI. You will be able to see there will be solitary or multiple ring enhancing lesions. See, these are nothing but your ring enhancing lesions. The one I am highlighting with the green are nothing but your ring enhancing lesions. See, this one is also your ring enhancing lesion, right? Next you have is the fungal infection. In the fungal infection, what is the main hero? The main hero are the Candida albicans. Candida albicans are the main hero. They attack your microglia. So the Candida albicans mainly attack your microglia. That is there in your brain. So it mainly affects the people who are immunocompromised, like the HIV, AIDS, and the diabetic patient. And guys, you know what? The patient who are suffering from diabetes, they are so prone to developing diabetic neuropathy. And if the patient is a diabetic neuropathic person, then he will not be able to feel the pain that his legs are suffering from. Like if he's walking on a path and there he got pricked from a stone or something like that. So what happens now? He is not able to feel that pain even. After 2 to 3 days, he will develop a infection. Okay, so that is the reality of diabetic neuropathic patients. Okay, the major fungi that you have, first one are your Aspergillus, then you have the Candida albicans, then you have the Cryptococcus neuroforms. In the Aspergillus, you have the it is angioinvasive and cause the hemorrhagic infarcts with abscess. In the Candida albicans, you have the microabscess with neutrophils and yeast. In the Cryptococcus neoformis, see, neoformis means it is mainly seen in the neonates, okay, mainly seen in the neonates. It gives you a soap bubble appearance. It gives you a soap bubble appearance. What are the clinical features that you can see? The clinical features that we can see: headache, seizures, focal deficit, cranial nerve palsies will be there. There will be cranial nerve palsies. How will you make a diagnosis? The diagnosis will be made on the basis of MRI, CT, and biopsy. Right? For biopsy, you have certain stains like the PAS stain and the GMS stain for fungi. They are basically nothing but your fungal stains. They are your fungal stains. For the Cryptococcus, you use a stain called as your Indian ink preparation. That is mainly for your Cryptococcus, and you will read that in your microbiology lectures as well. Okay. Next that we have is the parasitic infection. In the parasitic infection, the first thing that we will be talking about is the Neurocysticercosis. In the Neurocysticercosis, what happens is it is caused by a larval stage. It is caused by a larval stage. Larval stage of what? You have a species called as the Taenia solium. Called as the Taenia solium. And guys, you know what? You have two species of Taenia. That is, first one is your solium and the second one is your saginatum. Saginata, sorry. Okay. So solium is for pig and saginatas are for cow. And you know how you can remember? Solium is a small word. Pig is a small word. And cow is a very huge animal. So saginata is for cows. Okay. The most common parasitic CNS infection in India is your neurocysticercosis. Okay. Ingestion is through the fecal-oral route, right? Maybe we have drank that water of tap or the contaminated water that is there. So there are chances that this infection will get through our oral route, and through our oral route it will go into the GIT and will cause problem. Next, stages that are there. See this. Small lesions will be there in your neurocysticercosis. Okay. There will be degenerating cyst and ring enhancing lesions. There will be calcified dead cyst will be there, and the seizures focus. And the clinical features, what you will be able to see, there will be seizures, there will be hydrocephalus and focal deficit, and obviously the increased intracranial pressure. How will you make the diagnosis? The diagnosis will be based on the imaging. You have the Scolex pathognomic. Then you will do the serology like ELISA and EIGB. For the treatment, what you will give? For the treatment, remember, you will give albendazole. And Government of India also runs this program that they do what? That they do deworming of school kids. What is that program called as? What is that initiative? That you have to tell me. Okay. So you will give albendazole or praziquantel for 15 mg per kg for 28 days. Then next thing that you have is the toxoplasmosis. Toxoplasmosis is basically caused by the Toxoplasma gondii. It is a CNS infection. What is the pathogenesis? There is reactivation. There is reactivation of latent infection. What is latent infection? The infection has occurred prior, has occurred earlier in your body as well. Okay. This involves basically your basal ganglia. In the imaging, what you will be able to see? In the imaging, we are able to see a multiple ring enhancing lesion with edema. What is the differential diagnosis? The differential diagnosis can be primary CNS lymphoma. For the treatment, what you will give? You will give the pyrimethamine, the sulfadiazine and the and the folinic acid. So you will give the PSF. PSF for the treatment of toxoplasmosis. Okay, just like you have CSF, you have PSF. Then next that we will be studying about are your amoebic infection. The first amoebic infection that you have is the Encephalitis. What happens is they will give you a history of person swimming in contaminated water. So what happens when the person swims in the contaminated water via his nasal route? This amoeba goes into the brain and causes the disease. Next that you have, and one more thing guys, the cases of this particular amoebic infections are gradually rising in the state of Kerala. Then you have the acanthamoeba. They are nothing but the chronic granulomatous encephalopathies, and here they will give you a history of contact lens. They will say in the question that the person was wearing a contact lens after washing the contact lens with the help of a tap of water. Okay, so obviously the contact lens are getting contaminated. Next that you have is the hydrated cyst. Hydrated cysts are caused by your Echinococcus granulomas. Okay, so what are they? Like this is your liver, and here they will be here. They are nothing but the solitary, spherical and fluid-filled cysts. Present in children and younger, there will be a treatment. You know what? There is a pair surgery for this. There is a pair surgery for this surgical excision without the rupture. Okay. Pair basically represents your puncture, aspiration, and repair. Okay. So this is nothing but the pair surgery that you will read in your surgery lectures as well. The last one that you have are your viral encephalitis. In the viral encephalitis, first one that we have HSV1, that is your herpes simplex virus. So they are the most common sporadic encephalopathy in adults. They affects the temporal lobe of the bone. They affects the temporal lobe of the bone and causes the hemorrhagic necrosis What is the clinical features you will be able to appreciate? There will be fever, there will be seizures and bizarre behavior. Bizarre behavior means the person will be one time be very happy and one time be very aggressive. The behavior of that person you will not be able to identify, and it's a very bizarre behavior. There will be memory loss. Diagnosis will be based on the CSF findings and the PCR. For the treatment, you give the acyclovir. That is nothing but your antiviral that you will read in your pharmacology and tell me. Next that you have is the Japanese encephalitis. I have told you. In Japanese encephalitis, what happens is there is a Culex mosquito. After that, what happens? When you come in contact with that mosquito, the mosquito bites you. Then what happens is this infection basically goes to your brain and involves the thalamus, the substantia nigra, and the basal ganglia. And then your legs becomes swelled. I'll draw it for you. Like, this is a person. This will be the one leg of the person. This will be the another leg of the person. So this is nothing but the encephalitis. Okay. Then clinical features will be, there will be fever, there will be headache, coma, and the extrapyramidal signs. What is the treatment you will give? Treatment is always supportive. There is no specific antiviral that is involved. Causative agent is your Culex mosquito. Next that we have is the rabies. Rabies is a 100% fatal disease. It's a 100% fatal disease. You have something called as the Negri bodies. They are present in your hippocampus. What are the clinical features? There will be hydrophobia. There will be fear from the water. Okay. There will be aerophobia, agitation, paralysis, and after the paralysis, there will be death. What is the treatment? You have to, there are the regimes, the post-exposure regime and the pre-exposure regimes, right? You have a proper schedule for them. Okay, that you will read in your PSM. Next that you have is the HIV encephalitis. What happens here? There will be multinucleated giant cell which progress to dementia, and they will cause the cognitive decline. The ability of think of that person will be declined. Okay. Subacute sclerosing panencephalitis. What is that? There are late complications of measles, right? Measles is a virus that basically affects the children's. This occurs after 1 year. This occurs after 1 year. There is cognitive decline. There is cognitive decline. Okay. Investigations that you will follow. What are the investigations? You will do the neuroimaging, that is your mainstay. Then you will do the serology like ELISA, PCR, and antigen test. There will be biopsy, that will be in cases of atypical and unconfined cases. How will the CSF be helpful? CSF will be helpful if the patient is a case of viral, TB, or fungal infections. What are the treatment principles? This is your basically the journal protocol. Journal protocol that you have to follow for each and every step. Like for the bacterial, if there is bacterial abscess, you will give the antibiotics, B for B, and the surgical drainage if required. For tuberculoma, you will give ATT plus steroids. For for fungal, you will give antifungals, and for the parasitic, you will give antiparasitic drugs, steroids, and anticonvulsants. For the viral, you will give the antiviral and the supportive treatment if there is any. What are the complications? If there is raised intracranial pressure, what will happen? There will be herniation, right? I'll give you example. If there are like your room has a capacity of let's say 4 people and you accumulate 20 people in your room, what happens? 1 or 2 person will be thrown out of the room, right? Similarly, if there is increased intracranial pressure, there will be herniation as well. There will be seizures, hydrocephalus will be there if there is any obstruction, and the neurological deficits will be there, right? So this was all about the chapter of your parenchymal infections. We have read about the infections, bacterial, fungal, viral, and parasitic. If you are having any sort of doubt, please feel free to reach me, feel free to DM me. Thank you so much.